Kathy is my first one patch wonder customer, and it took her a week to respond to my reach out when she first received her patches and started using them. And I got all nervous about it. I was like, oh gosh, what's wrong? I hope she's not upset. And when I finally got her on the call, she said, what is this voodoo magic, Deb? And so, Kathy, can you just share with us, because the reason she started with us was she was already looking for stem cell therapy treatment via injections for her knees. So can you just tell us about your One Patch Wonder experience, Kathy, please?
Yeah. I'd had a left knee injury for about 12 years. And they trimmed back the ripped meniscus cartilage, but they did say you will get arthritis and ultimately you will need a knee replacement. So for quite a lot of years, I'd put up with my knee being like a football, the pain and that. And the hardest thing was I'd always been a gym junkie, and gradually I found I couldn't do that anymore. So I asked the doctor to refer me for knee surgery. And because I'm a type 2 diabetic, the surgeon wouldn't operate on me. However, he did come back and he did me a huge favor by saying, if you pay me $39,000, I can do it. So obviously, your diabetes switch gets switched off when you pay for private medical. So it made me so angry. I started to research stem cell therapy. I was prepared to go to Malaysia or China or somewhere and have a look out of sheer anger at this surgeon. And I was in the middle of researching that when I met Deb, and she had one of these on the table as we was having coffee, and I just said, "What's that?" And she was a bit reluctant to do the sale thing on me, but she knew she'd get 1,000 questions. And she said, "Oh, it's stem cell." The minute she mentioned it, the word in my head was, "Oh, the serendipity."
Right. Yeah.
Immediately. Like, I can't believe she. So she briefly explained it because she was still learning herself. And I went away and I researched it and had a look. And I thought, well, if I do this, I can then honestly say I've tried everything before I pay $39,000 or go overseas to have the knee operation. And I didn't want to have an operation because where I live, there's several people that have had knee operations. Some are good, a lot are not.
Right.
So
So
there was
what
no
happened? What happened on that first day, Kathy?
right. So I came back to you and got the patches. And on the first day, with my knee, I couldn't get out of the chair. I had to stretch my leg, stand up, do a couple of hobbles, and then I could walk. I was okay. But I couldn't stand straight up. So I put the patch on and I realized that day I've got straight up out of the chair. And I thought, nah, it's wishful thinking. And so I gave it the week and I tried all sorts. So I couldn't kneel down, I couldn't run, I couldn't do the gym, I couldn't do any of that. And so I thought, I'm going to put this to the test. So I did the kneel down, I got up and I'm like, up and down and up and down, putting it to the test. And then I rang Deb to say, I just can't believe these patches have done that.
Yeah.
But
Great
luckily
deal.
I
Yeah.
understood stem cell. But the thing is, how long, Deb? I must have been on these patches now about 18 months or so. So the
Yeah.
immediate result, like some of these ladies, you get an immediate result where the inflammation went down, the pain went away. So there I was, off I went. But now I'm actually running for 15 minutes on the
Mm,
treadmill.
Wow.
I've
that's
not been
amazing.
able to run on a treadmill for 2 or 3 years at all. And so I can kneel down, I can get up. I can honestly say that knee isn't as strong as the other one,
Mm.
but it'll get there. And then I've got type 2 diabetes. So I've had to be treating that with other methods. But what I take the glutathione to help
Mm.
the liver and do all sorts of things. But I think the biggest thing for me last year was coming back from the UK, where I landed in a heap of stress. And when I arrived back, I'd lost 10 kilo. I looked 80. I was so wrinkled, all my muscles were hanging, my legs were hanging. So
And you'd left your patches at home, hadn't you?
and I'd left the patches at home. Yeah. But I was in such a state over there, I don't think I would have remembered to even use them, to be honest. So I came back and started using them, and I started using the Aeon and a couple of others as well. So now my skin's all cleared up, the
Yeah.
collagen's kicked in, and I do not need surgery on the knee.
That's awesome. That's amazing, Kathy.
Yeah.
Thank you so much
Yeah.
for sharing that. And it's actually
So I've
really
toned
good.
right up, you know.
Yeah, it's actually really good to hear from someone who has started patching, stopped patching, and noticed,
Yeah.
and then started again and noticed actually the difference. Because that is something that we get asked quite a lot by people. Do I need to do this
Yeah.
forever?
Well, I'm about to finish my last pack of 3, and I'm going to have a break again just to test it.
again,
Because
because there's
test it
just no
again,
pleasing some
because
people.
so many things like my diabetes, I'm actually I've almost reversed insulin resistance, and
Yes.
that's 2 years of hard work trying to do that. So I think if I stop them and test it, you can then honestly come on and say, that's what I did.
Yep, there you go. And Sue's just also put in the comments there that the SP6 complete will balance
Yeah.
your type 2
Yeah.
diabetes as well.
Yeah.
Thank you so
Thank you, Kathy.
much, Kathy. That was a great share. It's
All right.
nice to hear from you again. It's been a while.